Again, we want to thank everyone for coming and taking time to address some of the things that are facing our nation. I'd like to thank also the Achievable Dream Middle and High School for hosting us this evening. And I'd like to thank all of everybody for coming. Joining us this evening on what we're on the Affordable Care Act, also known as Obamacare, and how that's improved Medicare, proposals pending in Congress. We have Eva Dominguez with the Alliance for Retired Americans, Brenda Sulick with the National Committee to Preserve Social Security and Medicare, and Lisa Walker, who is Vice President of Bay Aging. Their full bios are on the agenda, so we're not going to go through all of that. But we know that our nation is in a fiscal crunch. The federal budget deficit exceeds $1 trillion last year. Every year since the Bush administration. At the end of this year, the nation is facing what's called a fiscal cliff. The Bush-era tax cuts expire. $1 trillion automatic cross-the-board cuts kick in. That's called the sequester. And all of that happens all at the same time. Earlier this year, the House of Representatives passed a budget that cuts trillions of dollars in taxes, basically skewed to the wealthiest Americans, and pays for them with huge cuts in Medicare and a lot of other social domestic spending, including education, Head Start, NASA, community health centers, Meals on Wheels, air traffic controllers, about everything you can imagine. I've got some charts to show a little bit about what the situation that we are in. And we'll take a little bit here to see, make sure I can do the right one. This is, can we pass out the charts for everybody? Charts? Okay. This shows a real challenge in trying to get cuts in the deficit reduction through budget cuts, because you can see that by the time you've gone through Medicare, Medicaid, Social Security, and income security, stuff like unemployment compensation and things like that, interest on the national debt, by the time you've gone through that, you've gone through about 65% of the budget. Half the rest is defense, the rest is non-defense. So if you're trying to get cuts in what people call non-defense discretionary spending, if you had a 10% cut in everything, it'd only be less than 2% of the entire budget. So if you're looking for huge cuts in the budget, the only place you can go essentially is Social Security and Medicare. In fact, the budget really isn't, if we would get back to where we used to be in terms of budgeting, this is a percentage of GDP. The yellow line is revenue, taxes, and at the one point in the Clinton administration, we were taxing at about 21%. If we could tax at 21%, we would almost have a balanced budget today covering everything. You can see what the challenge is. Healthcare costs are growing faster than the GDP, which means that if we can cover everything, but unless we get healthcare costs under control, we'll always have a problem. This is just a list of some of the budget items and give you an idea of the size of some of the budgets. We're looking for $4 trillion in deficit reduction to get the budget under control, $4 trillion in 10 years. And this gives you an idea of what 12% sequester would do. Say by NASA, $1.6 billion. We're trying to get to $400 billion a year. And you're doing it in little chunks like that. It's obviously going to be hard to do if the only thing you do is budget cuts. Now, one of the things that the House budget does is it ends the Medicare guarantee, puts insurance companies back in charge, and really shreds because they get a lot of cuts, non-specific, but a lot of cuts in the non-defense discretionary part of the budget. And part of the challenge is is trying to get people to put numbers on line items so we know what choices are being made. We do know that there are choices in the budget that the House passed that make it, that have tax cuts for millionaires at the same time they have budget cuts in education, transportation, a lot of other things that we desperately need. When they put numbers on line items, then people can make the choice. Well, maybe we don't want to cut Head Start too much. Let some of the tax cuts expire, but you can't make those choices until people put numbers on line items. One of the things about the Medicare guarantee, let me just mention Medicare guarantee specifically, because you've heard proposals that they start off with, if you're 55 or over, don't worry about what's going on. You will be protected. Well, the first thing that ought to occur to everybody is, what are you being protected from? How bad a plan is it that people need protection from it? And the other is, if you need protection, who's going to be there to protect me? I just got my Medicare card a couple of months ago. I expect to be on Medicare 20 years, at least 20 years. 20 years from now, the people that will be in Congress are the people who have to answer in town hall meetings. I don't mind paying a Medicare tax if I'm going to get Medicare. But if all I'm going to get is a piece of voucher, then that's all I can pay for. And if the voucher is good enough for me, it's good enough for them. What's going to stop Congress 20 years from now from repealing that promise because the voters made them do it? The people in Congress 15, 20 years from now aren't going to be the ones making the promise to begin with. And then the other little quiet thing is the people being protected, they aren't really being protected. People 55 or over, if you look at the plans, first of all, you lose your preventive care. On Medicare now, you get free prevention, cancer screenings and whatnot. That's free, no copay or nothing. Well, you lose that. Well, it goes in the donut hole. They're going to reopen the donut hole. And they're going to put money back into Medicare expenses, which means that your copay will go up. And people keep talking about the $700 billion that was taken out of the budget a couple of years ago. The same $700 billion that was in the Republican budget this year, same money. The only difference is we used it basically for Medicare, extending the solvency another 8 years, to 12 years total. It's always been going broke. It'll go broke in 12 years under the plan that we have. Under the Republican plan, it goes broke in 4 years. You get less coverage, and it goes broke quicker. The money that was taken out. They said you need to clean out fraud, waste, and abuse, corporate subsidies, overpayments to some providers, and other savings as we went down. Efficiencies of a hospital. If you go back to a hospital shortly after they let you out, they're not going to get paid twice. If you get your car out of the shop and it goes right back, you don't expect to be billed again for the same thing you're supposed to fix the first time. So if you go back to the hospital, at least encouraging them to do a good job the first time, not rewarding them for failure. All of those things added up to $700 and some billion. And then you use that to help pay for the free prevention, low pay, fill in the donut hole, and extend the solvency for Medicare. They used it to help balance their budget, which included significant tax cuts, including tax cuts for millionaires. So the ones that are protected aren't protected. The other thing, those that are below 55, they can begin, as soon as they get a Medicare card, paying about $6,500, $6,400 more a year in health care than the Medicare card would have provided. Tens of thousands of dollars for people in their 40s, hundreds of thousands of dollars more during their lifetime for health care because they got a piece of voucher that was insufficient to cover what Medicare is covering now. So people are not protected over 55, even if they were protected in the plan. There's no guarantee that the protection will be there. And those under 55 get a raw deal. Those are the facts, and people who say they support such a thing, in order to preserve tax cuts, because if you let the tax cuts expire, you've got enough deficit reduction to meet the Simpson goals goal. So they're cutting Medicare to help pay for these tax cuts. Those are choices that have been made. I think most people, when you lay it out, will say, well, no, don't extend tax cuts to the wealthy. Keep Medicare the promise that it is today, so the families don't go bankrupt with their health care costs. Now, as I indicated, the ACA, the Obamacare, and then a few months ago, people used Obamacare as a term of derision, criticizing the plan. It occurred to some of us that if we are embarrassed to have a name after us, then we must be acknowledging something's wrong with it. I have suggested that the president doesn't want to name it after him. I voted for it, call it Scott Care. Remember, every low-income student that goes to college today knows who to thank because they got a what? A Pell Grant. Claiborne Bell, U.S. Senator from Rhode Island, gets credit every time a low-income student goes to college. I like it every time you go to the emergency room, thank God Almighty that Bobby Scott was there because I could pay his bill. So the president is not taking credit for it. He couldn't take credit for it when he was going to do this. That would have been too arrogant. But since the Republicans have insisted that he take credit, he has decided, okay, so every time somebody gets sick, every time a young adult on the parents' policy has an automobile accident and they own the parents' policies, every time somebody can get preventive care, a screening where they can catch cancer early when it's curable rather than late when it's too late, children in the donut hole, and everybody can get affordable insurance coverage. We've been working on that for 100 years. We finally got it. If you want to give somebody credit for that, I want the credit. The president is getting the credit now because we're calling it Obamacare. But it extends the solvency of the Medicare Trust Fund, the incidental home, free prevention, no co-pays and deductibles, no insurance abuses. When the insurance company gets tired of paying, that's too bad. They got to keep paying. They can't say we paid enough. They're in the middle of your treatment, so they say you're on your own. No, there's a limit not only to what, there's no limit to what they got to pay, but there is a limit on what your co-pays, and deductibles will be. Anyway, the financial outlook is substantially improved for Medicare. Solvency goes to 2014 under the House bill. Those broke 8 years earlier. They keep talking about the value of private insurance. The medical costs are going up. Medicare costs have been going up over the last 40 years. Been going up about 8.1%. Private insurance about 9.4%. Significantly. When you do this year after year after year, private insurance would be a lot more expensive than Medicare. So going to a private system obviously isn't going to be particularly helpful. I indicated that the budget has $961 billion in tax cuts for that portion of your income over $250,000. In the same budget that has cuts to Medicaid over $800 billion. And Medicaid is not only for low-income individuals and families, but also pregnant women, children and families, individuals with disabilities. But most of it goes for seniors. Seniors and disabled. The Medicaid budget, 2/3 of it is seniors and disabled. A few other adults. The children is only a small part of it. So when you start going after Medicaid, that's when you start seeing these advertisements where grandma gets thrown off the cliff. Well, that's what they're talking about. When you're cutting Medicaid, you're kicking them out of nursing homes. House Republican budget does all that, as I indicated, primarily to provide funding for their tax cuts. And who gets the tax cuts? This is an average of, you make over $1 million under the 2001-2003 tax cuts, you got over $100,000 a year in benefits from those cuts. 200,000 to $1 million, you got about 7,000. By the time you get down to what people make in the $50,000 range, you don't need any $80 more. So that's a little bit about what the tax cuts do, you talk about the problem, what's the solution? My solution, let all the tax cuts expire for everybody. Let them all expire. And if you let them expire, that light blue line is where you end up. You cancel the sequestration, you get a little bit of that pink, and that's about it. The purple, the reddish, is extend the tax cuts, and that's what sends the deficit off the chart. If you eliminated those tax cuts, you got everything pretty much under control. That blue is added debt service. By the time you run up all that debt, you got to pay interest on the debt. And so if you are down towards the light blue, that purple is not nearly as much as it's supposed to be. So if you just let all the tax cuts expire, that's where you're under control. If you have a better suggestion, if you want to extend the tax cuts, then you have to cut some spending, name what you're cutting. I think most of the people would conclude that they'd rather pay a little more tax and have a little better government, much better government. And when you look, like I said, that chart, what you have to cut to come up with the littlest amount of money in terms of deficit reduction, I think people will opt to let the tax cuts expire rather than cut all of those programs. I mean, we're talking about needing $400 billion a year. The legal aid program, for example, is only a few hundred million, not even $1 billion. So you can eliminate that, you knock out Head Start, you knock out air traffic controllers, and there's so much you could cut out and not come anywhere close to the $400 billion that you're looking for. And that's really the challenge when you're trying to inform the rhetoric that we can reduce the size of government by $4 trillion. Trying to conform that to numbers on line items, that's when the tax cuts expire, will get a lot more popular, a lot less unpopular than it is now. But we're going to hear from our experts. He was going to go first and talk about the Alliance for Retired Americans and tell us what we need to know about senior citizens and Medicare. Thank you. Give you a round of applause.
Thank you. Good evening. I'm with the Alliance for Retired Americans, and we're a group of 4 million members nationwide. We just started a chapter in Virginia at the beginning of the year. We have more than 50,000 members here in Virginia. And basically, we're made up of retired union members. And one of the things that we do is try to educate seniors a little bit about some of these programs that affect them. And we mainly work on Social Security, Medicare, and Medicaid issues. But also other things like Meals on Wheels and transportation, senior housing, all those things. All things seniors are really important to us. So I just want to give you a little bit of the basics about Medicare for some folks that maybe are not familiar. Can I just ask, how many people are on Medicare right now? Okay, so a lot of you, but there are some of you that are not on Medicare. So some might seem a little repetitive for folks that are already on it, but it's just good to get a basics before we go on to what some of the things that Brenda's going to talk to you about. Okay, so about Medicare. There are 158 million workers that currently contribute to the program. They contribute through their payroll tax so that they will be able to have Medicare when they retire. There are 47 million beneficiaries that receive benefits. Of those, 39.6 million are seniors and 7.9 are disabled individuals. Pretty much Medicare covers everything and anything that is medically necessary. There is no limit. And of course, this excludes vision and dental benefits. Those are not covered. The only thing that's covered under vision is if someone needs glasses after cataract surgery. If they need there is an annual glaucoma exam that's covered. They will also cover if you have a spot on your retina, or the doctor is following you on cataracts, because you suffer from them, they will cover that. But most routine eye exams, prescription lenses, frames are not covered, prescription contact lenses, and the refraction tests that are done in doctor's offices where they ask you, is one better or two better? That's not covered. But again, for certain things like cataract surgery, they will cover. But the important thing to know is that anything that is medically necessary is covered right now. If you take out dental and vision. And that's about to change if some of the proposals that are being discussed happen. And I know Brenda's going to go into that more, but that's important to keep in mind. Okay, Part A covers hospital coverage. And that is, as I mentioned, there are workers that are contributing to that program. And when you retire, whatever you contributed during your work years, there's a 1.45% contribution that's taken from your salaries as your work. That is to pay for the hospital coverage. And when you go into the hospital, there is a deductible every year that you have to pay. This year it's $1,156. As soon as you meet that deductible, everything will be covered for the first 60 days. And then after that, there are some other fees that you would pay. But definitely, once you meet the deductible, the rest of your visit will be covered for the next 60 days. Part B covers your doctor visits. It also covers outpatient hospital procedures. So for instance, if you go in to get something done at the hospital, but it's done very quickly, and you leave right away to go home, that is also covered under Part B. Speech and physical therapy is covered under Part B, and also durable medical equipment. The monthly premiums this year and it's paid for by the monthly premiums that you pay once you retire. When you retire at 65 and you go on Medicare, there's a monthly premium, and that monthly premium goes towards paying Part B benefits. This year, if you are an individual making less than $85,000, the cost is, the premiums is $99.90. Also for couples making less, it's $99.90. The premiums do go up for higher income individuals, so there are higher premiums for that, and I can give those if anybody asks. There is also a Part B deductible. The Part B deductible last year was $162. The Part B deductible actually went down this year. It's $140. So once you pay $140, everything is covered. Basically, 80% of any procedure or any doctor visit that you have is covered, and the senior, the beneficiary, pays 20%. There is something called the Medicare Savings Program that is actually, it's a Medicaid program. I know the Congressman spoke about Medicaid. Medicaid, many people think of Medicaid as a program for very low-income, destitute people. There's also this perception that it's only for like young people, that it's for children, pregnant women. But actually, as the Congressman pointed out, Medicaid is extremely important for paying long-term care services like nursing home and home health care. But it also is responsible for this Medicare Savings Program, which helps low-income seniors who cannot pay the Part B premiums. This is $99.90 I was talking to you about. And there's like 4 different programs that are under the Medicare Savings. And one of the ones that I put down here is the Quimby program. And it tells you what the income is and what the assets that you would, if you have those assets or are under those assets, you would qualify for that. I actually have a sheet that explains, if anybody's interested, it explains the 4 different programs. One of the programs, Quimby, basically covers your Part A and B premiums. It covers deductibles and co-payments and co-insurance. It covers pretty much everything if you're under the Quimby program. If you're under something called Slim B, they will cover your Slim B and QI. They will cover your Part B premiums, which is just the $99.90. And then there's another program, QDWI, which will cover your Part A premiums, which is basically Part A is the hospital insurance part of it. There are some people that, for some reason or another, don't have that. Maybe they weren't a job where they didn't pay into it, and this would help pay for that. I think there was a gentleman that was going to pass this out, but we do have some of these if anybody wants to see what they are, or if they have a friend or a neighbor that they would like to take this to, you're welcome to it. The next part is something called Medicare Advantage, and it's Part C. And I'm sure most of you guys have heard of this. These are the HMO type programs. There's also, more recently, they've created other things like Preferred Provider Organization, PPOs. There's a private fee-for-service that kind of works like Medicare, but it's privately run. And then there are medical savings accounts also under this program. But the most popular by far is Medicare Advantage. There's about 10 million seniors under the Medicare Advantage program. And usually what will happen is that they will cover your Part A and your Part B. So the government pays the Medicare Advantage programs. They will cover your Part A and your Part B. And oftentimes they will also cover your prescription drugs. They will cover all three, so it will be A, B, and D. So it's really important when you do, if you sign up for these programs, that you find out whether you are being offered prescription drugs as well. And in some cases, when you sign up with Medicare Advantage, they do provide your help with your Part B premiums, so that the $99.90 they may pay it all, or they may pay part of it, and that's why many people like to go on find that Medicare Advantage is helpful to them. And then finally there is Part D, which is the prescription drug program. This basically, the monthly premiums on average are running about $30, but it varies with the plan that you're on. There is inherent in the plan, there is a deductible that you have to pay every year. It's $320. So once you meet your deductible, they start covering you. Then there's something called a donut hole. The donut hole this year is $2,930 and $6,657.50. It used to be, prior to the Affordable Care Act, when you fell in the donut hole, seniors were responsible for paying 100% of the cost. Well, the Affordable Care Act, which is, as the Congressman well pointed out, people refer to it as Obamacare. And we at the Alliance actually like to call it Obama Cares. He cares about seniors, and this is why he supports this. Well, that basically, when that law passed, there was a 50% help, 50% discount for folks that fall in the donut hole. So basically, it's like having your drug cost by 50% when you fall in the donut hole. Those are discounts that are provided for you. There's also a subsidy for brand name drugs, for generic drugs this year. It's a 14% subsidy for generic drugs. And beginning in 2013, there will be subsidies for the brand name drugs as well. So this 50% discount that you're getting this year is going to start to shrink every year. And by 2020, it will shrink to 25%. So what you will have in 2020 is that you will have the deductible, and once you pay the deductible, you will be responsible for 25%, and the Medicare program will pay 75% of your cost. And that will be all the way up to you get to this maximum amount of what's called catastrophic coverage. When you hit the catastrophic coverage, you are only responsible for paying 5%, and Medicare will pay 95% of it. And the maximum out-of-pocket cost this year, this is what is the catastrophic, is $4,700. So, and this includes your deductible, your co-pays, discounts. Once you meet that deductible, once you meet that $4,700, Medicare will pay for the costs, and you will only be responsible for 5% this year. But what you have this year, again, is a 50% discount, and you get a subsidy for generic drugs. And I have something also, something that was passed out earlier, that it's called Healthcare Benefits for Seniors in 2012, which tells you exactly some of the things that are that you will get now as part of the Affordable Care Act. It's the preventive screenings that the Congressman spoke about. There's also a blue card that I have that if anybody wants, it's a card that HHS, I think that was passed out as well, that basically tells you all the different screenings that are available to you, and you can take that to your doctor. They can check off and see if you've already had it or when you're due next. They can put the date on it. So that's a very helpful for you to use it when you go to your doctor's office. I wanted to point out something really important, and that's that open enrollment is going to begin October 15th. There's a change this year in the date. You basically have a longer period of time. It starts October 15th and it ends December 7th. This is the time where you can go and sign up for a Part D prescription drug program, or if you don't like the plan that you're with, you can switch to another plan. Dual eligibles, which are individuals that are both on Medicare and Medicaid, they are automatically enrolled into a plan. But if you are not a dual eligible, if you're not on both programs, you need to sign up yourself. And the thing is that once you sign up with a program, you are stuck in that prescription drug plan until the next open enrollment season, which is a year later. So it's important to make sure that the drugs that you need are on their formularies. And that's something that's extremely important for you to look into. That the drug plans can change their formularies every 3 months. So that's unfortunately something that we have not been able to change. I personally don't think there should be any kind of, if you're stuck in a plan, you should not be able to change the formularies. But it's just really important that when you do get on a plan, make sure that they do cover the drugs that you need. And then the last thing is that there is extra help for individuals that need basically there's help for low-income individuals for the Part D program. This extra help covers your premiums, deductibles, and co-pays. And if your income is less than $16,335 as an individual and $22,065 as a couple, you would qualify. If you have assets less than $12,000 as an individual, and then less than $25,260 as a couple. Some of the things that they count towards your assets, it's your bank account, anything you have in checking, savings, CDs, real estate, excluding your home, your residence. If you have like a secondary residence, like a vacation home, that would be counted towards your asset. If it's your primary home, it would not. Stocks and bonds, mutual funds, and IRAs are all covered as your assets. But if you are under those income levels, then you would qualify. There is some individuals will get the full subsidy, and some individuals will get partial subsidy depending on where your income is. So we can get you more information if anybody's interested in that. And so I just wanted to give you the basics, and then I'm going to turn it over to Brenda to talk more about what some of these changes that are being discussed up on Capitol Hill. We have some very real concerns. We also have something here that we put together called the Ryan budget for fiscal year 2013. This is the budget that Congressman Bobby Scott was just referring to. It has exactly all of the things that we are very concerned about, all the things that how it would impact Medicare and Social Security, Medicaid programs. So please, take a look at it. And I'm here for later if anybody has questions. Thank you.
Good evening. Hello, everyone. Can you hear me okay? I have a loud voice to begin with, so I don't want to be shouting at you. Okay, great. As mentioned, I'm Brenda Sulick, and I work at the National Committee to Preserve Social Security and Medicare. And if you're not familiar with our organization, we've been around for about 30 years. We were started by James Roosevelt, Franklin Delano Roosevelt's son, and our whole purpose is to work with, we're a membership organization. We work with members all across the country, and our goal is to make sure that Medicare and Social Security are preserved and strengthened. We have, I think, a very good website, and my colleagues get the credit for this, but they're very good about breaking out information. And if any of these issues that you don't understand, please go on there. We have fact sheets on just about every issue, and we really try to break it down because these are complicated issues, and I don't understand all of them myself. Okay. I'm sorry, I don't know how to use this. Okay. Which one? Point it and then hit the little round button. Sorry. Okay. Well, it's very nice to be in Newport because I was here once for a couple hours 20 years ago, and Eva and I drove in, left and right, thank you, and got to see how pretty it is, and we got stuck on the drawbridge, so we got to view the water for a while, and that was beautiful. So, okay, a number of the things that are on my slides were already mentioned by the Congressman and Eva, so I won't read through everything, but I'll pull out a few highlights of things that are important. Our organization believes that Medicare, like Social Security, is based on the promise that if you paid in during your working years, you've earned the right to guaranteed benefits, and these are really vital to all Americans. And in my few minutes with you, I'm going to talk a little bit about who benefits from Medicare, some of the benefits, changes to Medicare from the Affordable Care Act or Obamacare, and then some of the proposals that are out there to change it, and then what our organization thinks about them. Just want to mention, Medicare is, many people here are on Medicare, so you know how important it is. It's very important. There's over 20% of Medicare beneficiaries are from communities of color. I'll show you on this next slide. These tend to be people who have a number of illnesses, and they really need care. Nearly half of Medicare beneficiaries have 3 or more chronic conditions, and 30% have a cognitive or mental impairment, such as Alzheimer's. Minorities have a higher risk than whites for certain chronic conditions, such as diabetes. And the bottom bullet is what I want to pull your attention to, because I don't know about you, but I get kind of frustrated when I hear talks about how rich all the seniors are. And I don't know, my family isn't, none of the people I know are. And this stat comes from the Kaiser Family Foundation, and they're a nonpartisan research organization. And over 1/2 of Medicare beneficiaries had annual incomes of less than $22,000. And about the same amount have savings of less than $53,000. So programs such as Medicare, as you all know, are very important. An illness could put you in bankruptcy, of course, without these programs. These other points Eva covered, but the top one I also want to point out is seniors, Medicare beneficiaries, spend 3 times more of their budgets on health care than younger people. So we see that a lot of people don't have enough money, very much money to begin with, and then 15% of it is going to health care. So there's not a lot of room here. I'm going to just skip through these because Eva went through that. And the Congressman went through the spending part. But the last point I want to call your attention to. Medicare is a target for federal deficit reduction. The Congressman mentioned this, and this is something my organization is concerned about. We do believe that there may need to be some changes to Medicare over time, but we don't think that it should be paid for on the backs of seniors. A number of good things have come out of Obamacare, or the Affordable Care Act, and you've heard these, but I'm going to mention them again because as I talk to different groups of people, a lot of people don't know what's in the Affordable Care Act, and because of it, there are benefits right now that you can be taking advantage of. So I'm going to just repeat these. It was mentioned, you now have preventative screenings, a free annual wellness visit, prevention cares with no out-of-pocket costs. We found before when people did have to pay for those, they just skipped care or didn't go. And then what happens is you don't catch your illnesses early on, you get sicker, it costs you and the healthcare system more money. The donut hole will close. As was mentioned, it slows Medicare spending. And it puts the private Medicare Advantage plans in line with traditional Medicare, which most people have. And it extends the financing for 8 years. Okay, this is one of the proposals that has been put forth as a way to do something about Medicare. And I just want to mention, certainly we want to make sure that there are no cuts in Medicare, but just consider Medicare right now, because of the Affordable Care Act, is extended to 2024. And then when we get to 2024, if nothing was done, which something will be done, but it still can pay 87% of hospital insurance of your Part A. And I bring that up because certainly these are things we need to deal with, but I think people get scared a lot. I think for Medicare and Social Security, sometimes there's a lot of misinformation out there about how bad off these programs are. This is the voucher system, this idea of premium support. And this is very different than what the current system is, which is, I feel like I'm yelling at you, sorry, is traditional Medicare, as was mentioned. You have a guaranteed benefit, and you pay your premiums and your deductibles, but then it covers whatever your health care costs are. Under this proposal, you would receive a voucher for a certain amount of money, and you would be required to purchase a health insurance plan, be a private plan or traditional Medicare. But what will happen is if there'll be the voucher amount will be set, they're going to do a bidding process, but it'll be the second lowest bid. That's what Medicare, the voucher amount will be. And our concern is that for really sick people, okay, you have that, and if you need more health care, you're out of luck. I mean, right now, that's not the issue. And what could happen is we could have a two-tiered system where there's people who can afford for health care and all the supplemental things, and then other folks. So we are worried when you hear ends traditional Medicare, that's kind of what we're talking about. It essentially privatizes the system, and it leaves people to deal with insurance companies. And I like to point out, like, why do we have Medicare? Because before Medicare, seniors couldn't get insurance. Insurers did not want to cover them. In 1965, over 50% of seniors had no health insurance and 35% lived in poverty. Programs like Medicare help get people out of that. We think the costs may go up for people because, as was mentioned by the congressman, healthcare costs are rising faster, and you may end up having to pay more. For the people who stay in traditional Medicare, you can still do that, but our concern, my organization, is that the private companies will try to lure some of the healthier people, then the sicker, older people will still be in traditional Medicare, and the premiums could go up, and eventually the program could kind of just wither. Also, under a system that uses vouchers for private plans, we think it can make it harder for seniors to choose their doctors. When you work with the private plans, they have a network of their own doctors. And you may have been working with a doctor for a long time, and they may not be in that network that you've paid for the voucher. So right now we think that, even though there are some doctors I hear often that are taking Medicare less and less, I think you really have a problem with access under this. And again, it also rolls back those benefits that we talked about in the Affordable Care Act, preventative screenings, and paying for prescription drugs. This is also in the House-passed budget. It would raise Medicare's age to 65, from 65 to 67, to be eligible for benefits. Now, on first thought, you might say, well, people are living longer. That kind of makes sense. But when you really look at the numbers, not everybody's living longer. People who have better health care and high incomes are living longer. And what this would do is, if you were those ages, between 65 and 67, your costs would go up. Because it's going to be hard for you to get private health insurance, because it's, people have chronic conditions. And one report showed that the cost would increase up to about $2,200 for this population. Another proposal is to increase costs to Medicare beneficiaries. Some proposals would have people pay additional Part B deductibles, a home health copay, a surcharge on Medicare, Medigap programs, and setting premium percentages a little higher. Other proposals that are being discussed include expanding needs testing. As was mentioned, Medicare is already needs tested. So people that pay more, have higher income, pay higher deductibles and premiums. But what the Kaiser Family Foundation found that over time, over like the next, I think it was 10 to 12 years, based on how much health care would increase, this, in today's dollars, eventually this would keep, it would end up affecting people in today's dollars of about $47,000 for an individual and $94,000 for a couple today. And that doesn't seem that wealthy to me, especially when people have high costs. So what should we do? I'm up here saying, okay, this might not work, this could be bad. These are some of the ideas that the National Committee thinks we could strengthen Medicare without having to cut benefits for seniors. One is to continue what's been going on in the Affordable Care Act, focus on efforts to prevent, detect, and recover improper payments or fraud, waste, and abuse. Just in the last 2 years, since they've really been focusing on this, I've seen different numbers, but it's like between 5 to 10 billion has been recovered. I mean, that's a lot of money, and this could be put back in the system. So that's one way to focus on it. Have drug manufacturers provide rebates for drugs for people who get Medicare and Medicaid. Promote lower pharmaceutical costs, expand the availability of generic drugs. Allow the government to negotiate drug prices in Part D. Right now they can't do that, but the VA, the Veterans Administration, can do that. And if we could do that for this large pool of folks, there should be a lot of savings. And also, the Affordable Care Act has only been in place for 2 years, and already we've seen some benefits. So give it some time to go into place, people learn about it, and see how it continues to benefit folks. Okay, last slide. What's ahead? Well, regardless of who becomes the next president, Medicare is going to be on the agenda. There's big budget deficits, but the issue will be, how do you want to resolve these issues? I mean, do you want to keep traditional Medicare? Do you want to privatize it with the private plans? That's some of the things you need to think about. This was mentioned that across-the-board cuts could happen, and this is an issue that you're going to hear about a lot. I just want to end with, again, my organization, we are all for strengthening the systems, and that's what we're all about, but we oppose cuts to Medicare and also to Social Security that really affect and shift the cost to seniors. We think that they've already been paid into these programs, they're their earned benefits, they're not the government's, and we need to continue to strengthen them. So in terms of the vouchers, the National Committee's position is that we think that they privatize the system, they end traditional Medicare as they know it. It could make it more difficult for seniors to choose their doctors, and you have to work with insurance companies. And we just think that there may be some other ways to do that. So I'm sorry, I've been talking a long time, and I know there's other folks who want to share comments, and also we want to get to questions. Thank you.